So what I'm going to demonstrate today for you is I'm going to demonstrate how to stretch the adductor group and how to stretch the abductor group. So let's get started. If you recall, the adductor group, okay, so the adductor group is a muscle that adducts the hip or the femur at the hip joint. And so adduction, as you recall, adduction is a crossing over of the leg or any extremity, but we'll talk about the leg here, crossing midline or coming approximating toward midline. So if my leg here is in anatomical position and the adductor muscle were to contract and tighten, the contraction and the tightness of that muscle is going to bring that leg into adduction. Now, as we move into adduction, just like where the quadricep flexed the hip and extended the knee, which then put the hamstrings here on stretch, the adductor group is going to put the abductor muscles on stretch. So if we'll use the left leg here, if the left leg adducted the femur at the hip, the muscles of the abductor group, which is abduction, right? Again, abduction is abducting away from midline. The abductor group originates on the lateral portion of the ilium and attaches to the femur. And so as that muscle adducts, this abduction muscle of the gluteus medius, is going to be put on stretch. So what I'm going to show you to start is how to stretch the adductor group. The adductor group also can be considered or is considered the groin muscle or the groin muscles. Very common for athletes and other individuals to know what that muscle refers to. So the adduction or the adductors is also the groin. So when we abduct the muscle, so when we abduct, we're going to put the groin or the adductors on stretch. So as I abduct and that muscle contracts, this adduction group is going to be put on stretch. So how do we stretch the adductors? That is the question of the day. The adductor group is most often a muscle group that is not very flexible. Doesn't matter the individual, but that particular muscle group tends to be very tight, not very flexible in the majority of athletes. And so a lot of times the range of motion to elicit a stretch of the adductor is not very large. Okay, it's a very minimal range of motion. So as I, again, with the hamstring, we asked the athlete to let me know when to stop pulling up. And even with the quadricep, we're gonna do the same thing. But at this point, we're going to bend the knee with one hand on the bottom of the foot. We're going to bend the knee with one hand on the bottom of the foot, and we're going to place another hand on the top of the knee. Now, what we can do is we can initially abduct the leg out and and at that point we would ask, okay, I want you to let me know when to stop pushing out. And then they say, okay, stop. At that point in time, what I can do is I can place their foot on my side and hold their knee with my other hand. And at that point in time, I would hold for 30 seconds. After 30 seconds concludes, I would, at that point, inform them, okay, I'm going to push your leg down a little bit. So you let me know when to stop. We want them to be uncomfortable, but not too uncomfortable. So we allow the leg to get pushed down. Gravity will also pull the leg down as well. And they say stop. Okay, we hold it there. And we hold for another 30 seconds. After 30 seconds is completed, we'll do the third pass. Let me know when to stop. Stop. And we hold for an additional 30 seconds. And that would complete the stretch of the adductors on the right leg. And at that point, we would then switch to the stretching the left leg. Now, the adductor muscle group is not a muscle group where with the hamstring and the quadricep, we had 3 or 4 different levels of flexibility for the individual. And we determined what that level of flexibility was. And from that level of flexibility, if you recall, we would perform a different type of stretch. For the adductors, there's just one level of flexibility we really work with for the most part, because as I said before, the majority of individuals will not be very flexible in the adductor. However, what we can do is we can stretch the adductor a little differently, and that is when let's just say there is a little bit more flexibility, we can bring the leg out as far as possible, as far as they allow us. So let me know when to stop. And then potentially the femur can adduct at a larger range of motion or a larger degree. And at that point, we would abduct the leg as much as possible. And at that point, we would hold the leg in position. Again, we would place the foot on the hip, on our left hip. So right leg, left hip. And again, this is obviously a model, skeletal model. So the leg typically is just going to fall here, but typically the muscles will hold the leg in position when they're tight, and it will hold in this position like so, without us having to do a whole lot. And so with that being said, we would just hold the leg, put the heel and the foot on our hip, and at that point in time, we could just hold for 30 seconds. And at that point, we would say, okay, 30 seconds is up. Let me know when to stop. And I would basically just allow the leg to fall as much as possible, or I would place slight pressure on the inside of the knee and push a little bit more. Let me know when to stop. And then the third pass, okay, let me know when after 30 seconds complete, let me know when to stop. And at that point would be the third 30-second pass. And we would complete that stretch for that individual, bring them back into position. And then we would stretch the left leg. A different type of stretch we can do is called a butterfly stretch. I'm sure many of you have heard of this before, and where the stretch that I just demonstrated is considered more of a unilateral stretch. Unilateral meaning obviously just one side at a time. This would be considered a bilateral stretch. So what we would do is we would place their legs in a flexed knee position and flexed hip position, and then the position also would be in abduction. We would also place the other leg in this position, okay, and we would get up on the table. And what we would do is to start, we would place our knees on their feet like so. And then allow their legs to abduct simultaneously on both sides. And again, with pants and obviously a live body where muscles are in play, the legs would abduct only to a certain degree. So we're going to try to mimic that as much as we can. So this is how it might look. At this point, this is already a 30-second hold. Okay, so we would say, okay, let me know when to stop, and we would just allow the legs to fall, right? We wouldn't be applying any pressure whatsoever. We would allow the legs to fall in a particular position, okay? And so at that point, we would hold for 30 seconds. And then I would then say, now, because there's so much tension on the adductors, even if we allowed them to say, okay, can you pull your knees out further, let them fall, the knees wouldn't necessarily fall because of the tension that's being created by the muscles of the adductor groups on both sides. So what we would do is we would use not a hand, but just a finger or a thumb on the inside of the knee, or a palm. Usually I don't feel that when I use a palm, I still don't feel like I can feel the movement. I feel I have, and we have better tactile sensation on the index finger and the thumb, but the index finger in particular. So I like to use the index finger so that I can feel the movement going down a little bit better compared to the palm. The palm, I can't feel the movement as much. The index finger, I can. So I usually will use the index finger and I'll push just a little bit. Let me know when to stop. It's not a lot. It's not a lot. Okay, so they will stop. It'll be 1 degree maybe. And it's enough though. 30-second hold. That's the second pass. Okay, let me know when to stop, and 30-second hold. Once you know the 30-second hold, you complete that stretch. It's not a lot. It's a very small degree. They'll inform you that they don't want you to go any further. The last component that I can show you with this particular stretch is sometimes the flexibility is better for certain individuals, and so we would bring their heels up toward their glutes a little bit more. Okay, so they would bring their heels up here in this position. We would slide our legs closer. Okay, and then they would have more abduction to work with. At that point, we would still do 3 30-second passes, but the flexibility is the range of motion into abduction to stretch the adductors is much better. You may even be able to get this type of range of motion in certain individuals that still actually is a good enough range of motion. It's still resistive enough to where they still feel a stretch. Okay, so that completes the adductor stretch. And I'm now gonna show you how to perform a stretch of the abductors.